sometimes occurs in the elderly is the neonatal lysoerythrolysis, otherwise called hemolytic disease of the newborn. You should be aware of why the foal gets it, how it gets it, and what can we do to prevent it.
So the reason the foal doesn't die before birth is because the placenta's high.
Yeah, it doesn't get any maternal antibodies, so it doesn't get any antibodies that can destroy its red blood cells. Okay. Other examples for type 2 hypersensitivity, if I put, sometimes equine infectious anemia, some viral infections such as those, equine infectious anemia in horses, can bind to the red blood cells and antibodies can then go and lyse those red blood cells that are binding the virus. Some drugs also can do that. Some drugs, as we know, can cause anemia. They can bind to the red blood cells and they initiate antibody-mediated lysis. So those are examples. Also, the other good one is incompatible blood transfusion. If you don't match the blood groups and transfuse blood, can lead to lysis of the red blood cells. So again, remember examples, important diseases for each of these 4 types of hypersensitivities. You should be able to say, for example, if I say rheumatoid arthritis, as you see on this slide, what type of hypersensitivity? Rheumatoid arthritis, you should be able to recognize it's type 3 hypersensitivity. Similarly, if I say atopic dermatitis, then you should be say type 1. Whenever you see that term atopy, it should be type 1. So let's go on to see type 3 hypersensitivities, which we call immune complex mediated. These occur usually after several hours as the antigens enter the body. And good examples are rheumatoid arthritis, for example, autoimmune disease where the patient develops autoantibodies. You will see that disease again when we talk about autoimmune diseases, but here the patient develops autoantibodies against its own normal immunoglobulins. And these autoantibodies, then they bind to the normal immunoglobulins, form immune complexes, get deposited in the joints, and in turn they attract neutrophils, as you are seeing on this slide. So, again, what you are seeing is the autoantibodies shown in the red are binding to, actually it should also show other type of antibodies, but they are showing these immune complexes. They are binding and then they are getting deposited either in the blood vessel walls like shown here. In turn, once they are deposited, they attract neutrophils to the site. When the neutrophils come, they degranulate. Neutrophil granules, as you know, are meant to kill the ingested organisms. But in this case, they degranulate to the outside, and these granules contain those enzymes which are kind of degrading to the tissues. And in turn, it also attracts complement, activates complement, and those are also damaging to the tissues here. So again, it's immune complex mediated. And where the immune complex are deposited in the body, that's where the disease develops. Question?
So the antigen is the immunoglobulin in this case?
The antigen is autoantibodies. When I say autoantibodies, in all autoimmune diseases, like rheumatoid arthritis, lupus, or other examples we'll see in a bit. The patient develops autoantibodies, antibodies that attack something in the body. We call them autoantibodies. And those are antigens in this case. And they bind to the normal immunoglobulins, which are antibodies, normal antibodies in the body. And so they form immune complexes and get deposited in the body. That's in the case of rheumatoid arthritis. Okay? But we'll go on to see a few other examples here. See, here you are seeing here antibody antigen complexes getting deposited in organs, activate complement, neutrophils degranulate, resulting in inflammation. Sometimes the immune complexes are deposited in the basal layer of the kidney, basement membrane, and cause glomerulonephritis. Immune complex mediated glomerulonephritis could be due to either bacterial or viral infections sometimes, or other immune complexes. Vasculitis is another immune complex mediated disease of the blood vessels, because immune complexes are getting deposited on the endothelial cells lining the blood vessels, causing inflammation of those arteries or veins, and that's vasculitis. Rheumatoid arthritis, you saw that example. Now you're seeing here the antigen, which should be actually autoantibodies, binding to the normal immunoglobulins, which are now shown as green colored antibodies. And these immune complexes in turn attract neutrophils to the site, and then these granules cause damage here. But in turn, it also activates complement proteins are activated, and those are also causing damage to the tissues here. So that is kind of example for vasculitis. So if you think this is the blood vessel here, immune complexes are deposited on the endothelial cells, attract neutrophils, activate complement. That's the problem. Sometimes immune complexes can deposit on the blood vessel, the red blood cells, and then cause lysis of those red blood cells also. Now, talking about immune complexes. Again, remember, these are antigen-antibody complexes, and these could be either soluble or big insoluble complexes. Insoluble complexes are usually bigger, they are phagocytosed and removed quickly by phagocytic cells. Not much problem with the insoluble, bigger complexes. Smaller soluble complexes, they are the ones. They can get deposited in the blood vessels, or in the kidneys, or in the joints, and then cause problems. Arteritis or vasculitis, meaning both same, inflammation of the arteries. Glomerulonephritis, inflammation in the kidneys, and arthritis. Could be good example is rheumatoid arthritis. Okay, again remember, soluble complexes are the problem. These are not phagocytosed well, and they get deposited in the tissues. Okay. Example, rheumatoid arthritis. We'll talk about this autoimmune disease again. Usually the patient develops in several joints, and typically they also show nodules, not clearly seen here in the dark, but usually the patients with rheumatoid arthritis will show some nodules, not like osteoarthritis that you see in old age, age-related damage to the joints. Okay. Again, that's what you're seeing here. Immune complexes can get deposited in the kidney basement membrane, on the basement membrane, and cause glomerulonephritis. And many infectious diseases, bacterial as well as viral, can lead to the development of immune complexes. What happens is the patient develops antibodies against these bacterial or viral pathogens, but sometimes they are not neutralizing antibodies. They bind to the bacteria or virus, form immune complex, and can get deposited either in the joints or in the anterior chamber of the eye, causing that blue eye condition, which you will see in a bit. Again, could be getting deposited in the kidneys, causing glomerulonephritis. I'm not going to ask all these examples of bacterial and viral pathogens that can cause immune complex diseases, but most importantly, you should remember, we talked about this canine adenovirus 1 causing blue eye condition in dogs, right? And then also FIP, or feline infectious peritonitis, in cats sometimes also causes that blue eye condition. There is a lot of infiltration. Once the immune complexes are deposited, there is inflammation, and a lot of neutrophils come to the site, degranulate, and activate complement. We see a lot of cells coming here. That's what exactly is happening. The virus, canine adenovirus 1, is not actually causing this problem directly, but the dog produces antibodies against that virus, but those antibodies are just non-neutralizing type. They bind to the virus, form immune complex, and those immune complexes get deposited in the anterior chamber of the eye, attract neutrophils to the site, activate complement, and that causes the problem here. Slowly, the immune complexes will be removed eventually by phagocytic cells slowly, and the animal may get better. Same thing as I gave that example, feline infectious peritonitis virus disease causing problem here. Again, remember, it's immune complexes causing the problem, not the virus. It's not directly damaging tissues here. Okay? So again, remember. That's all about immune complex mediated diseases. And lastly, we'll go on to see type 4, which is also a cell-mediated hypersensitivity. Doesn't involve any antibodies. As you have seen, the first three, type 1 is IgE antibodies, type 2 and type 3 could be IgG and IgM antibodies. But this one, type 4, also called cell-mediated hypersensitivity, also known as delayed type, because it takes 2 days to develop the hypersensitivity. What exactly is happening? As I said, a good example is intradermal testing for tuberculosis, TB. You all have gone through that. What exactly happens if a person or animal is positive? It will develop swelling and redness at the site after 2 days or 3 days. And that swelling is mainly due to the accumulation of the T cells, cells that have the memory, having seen that antigen before they come to the site. Okay? And in turn, they attract some macrophages also, or dendritic cells. That's what you're seeing here. T cells and macrophages or dendritic cells come to the site and cause the problem. Okay? Any questions on that type 4, delayed type or cell-mediated hypersensitivity? That's a good example is testing for TB, intradermal skin test. Swelling is again due to the accumulation of T lymphocytes, which in turn attract those macrophages to the cell. Poison ivy, again, if you go into the woods, next day may not see anything, but after 2 days you might see all those rashes. And that again is due to T memory cells. Again, in all these hypersensitivities, first time exposure do not cause any problem, even with the type 1 hypersensitivity. First time exposure do not cause problem. Second time, that's the problem. Some chemicals, you don't have to remember, a lot of chemicals might cause type 4 hypersensitivity. Even some creams or sprays, you apply a new cream or deodorant, after 1 or 2 days you see those blisters or vesicles on the skin. That could be type 4 hypersensitivity. Another example is the flea collars in animals. Dogs and cats fitted with flea collars, it might show some blisters after 2 days or 3 days, and that could be. But other examples are shown here that might be causing type 4 hypersensitivity. Whereas some sprays, whenever I walk into dealers, especially where they have all those cosmetics, spraying people, immediately my eyes start running, get headache, runny nose and all that. So remember, that's type 1. But if you apply some creams and you see some blisters and after 2 days, that's type 4. Okay. Comparing again between type 1 hypersensitivity, good example is atopic dermatitis, especially in dogs, as compared to allergic contact dermatitis, which is type 4. Again, contact dermatitis comes under type 4. So what are the differences? Clinical signs pretty much similar, but it develops so fast. That's the main thing in case of atopic dermatitis. Whereas it will be after 2 or 3 days. Mainly, you see all those allergens that might be causing the problem. Again, atopic dermatitis, again see that either it could be due to the allergens in the food or inhaled allergens, or it could be injected. So any of these can cause lesions on the skin, and that's atopic dermatitis. How do you diagnose? Again, you saw the slide on intradermal testing. You can buy a bunch of allergens common to the area of practice, do that intradermal skin testing. If you see the reaction in 20 minutes, that's positive. Whereas in the case of type 4 hypersensitivity, contact dermatitis, you can put a patch of that offending allergen on the skin, and if you see any reaction after 2 or 3 days, that's type 4. So that's why we call delayed response on skin patch. Okay. In type 4, whenever there is, you saw the slide on allergic asthma, there is a lot of eosinophilic infiltration into the site. But here it will be mostly T cells that have the memory response, and in turn they attract macrophages. And treatment, antihistaminics, of course, very commonly used. You can use prednisone, corticosteroids, prednisone, good example. And hyposensitization, you saw that injecting the offending allergen in increasing doses over a period of time, and that develops a lot of IgG antibodies that will block the allergen binding to the IgE antibodies. In case of this type 4 contact dermatitis, you apply those cortisone creams. You have all those cortisone creams over the counter and use those. Any questions on this? That's all I have about hypersensitivities. If not, let's go on to the next chapter here. Before I go on to these autoimmune diseases, at least I have one email about the final exam. Final exam is scheduled for December 9th, Saturday, 9 to 11. But you have virology also on the same day, 2 to 3 and 2 to 4. The proposal is to move immunology exam to either Wednesday, December 6th, or study day. They say it's a study day, December 7th, Thursday. So, depending on the complete agreement of the class, which I will hear from your rep, we can decide to have it on 6th. Wednesday, 6th is our class day. That's the last day of classes. We can have exam on that day.
You said it was the 6th or what?
The 7th.
7th.
Don't forget we have
7th is,
one.